I'm Dr. Samantha Dunham. I'm co-director at the Center for Midlife Health and Menopause at NYU Langone. I'm really focusing on midlife health and menopause. So that means everything that affects people with ovaries from ages 40 until about 65 and beyond. I ended up wanting to go into OBGYN after, during medical school, just the experience of doing OBGYN work, and I love the women's health aspect and the focus on sort of the knowing people over time, like the longitudinal relationships you develop with people, with patients. After being in the field, I noticed there was just a gap in care. It really is like a pillar of gynecological care, and it hasn't received the attention that I think it should. I mean, I personally had a really hard time finding a doctor that I liked, and I was interested in the field. And when you do all the all the clerkships in medical school, and I loved working with my hands. So it sort of all came together. So the Center for Midlife Health and Menopause is relatively new. The experience in menopause is really different for everyone. And then the treatments end up being very different for everyone depending on their history, their family history, their personal interest or desire for treatment. So we really learn about the patient and kind of investigate their background and see what's best for them. The most common symptoms are the vasomotor symptoms. So those are things like hot flashes and night sweats. They affect about 60 to 80% of women, and they affect people in the workplace. If at nighttime they're waking up all the time with insomnia, that often leads to mood changes. So they can be really disruptive. During menopause, women are affected with cardiovascular disease. Their risk for diabetes goes up, potential for bone loss increases. They have sometimes issues with genital urinary syndrome, and we have lots of resources within NYU Langone to help us manage these things. There's wonderful cardiology service, Urogyne service, urology service, terrific imaging. We really are kind of, I think, well placed to care for every aspect of women's health.